A new study and a new poll finds support for Arkansas hospitals, especially in the context of taking advantage of the parts of the federal health care law. Like it or not, in 2014, aspects of the law go into effect. Joining me to talk about the economic impact on Arkansas hospitals is BoRyall, president of the Arkansas Hospital Association. Bo, thanks for being with us.
Thanks for having me.
Let's talk about a couple things that you guys have put out a new study this past week that shows some of the economic impact of what the healthcare changes would be in the state of Arkansas. And one of the things that really caught my eye is something called the woodwork effect. Kind of describe what the woodwork effect is.
Well, in the new healthcare law, if we do take advantage of Medicaid expansion, then more people, we're looking at 200 to 250,000 more people that would be insured. But there's people out there who are eligible for the current Medicaid program who, as you say, would come out of the woodwork and then be covered under Medicaid.
And how big is that population? Is there an estimate on how large that population
Our studies
might be?
show that to be about 33,000 people.
All right. Why are they not in the system now if they qualify for the system already? What is it about the changes that brings them out?
Well, it certainly may be just not knowing that they're eligible, not knowing the rules of eligibility. It could be the stigma of Medicaid.
All right. Let's talk about what's going on in terms of what your study showed. Tell me, first of all, who produced the report for you, what you had asked them to do, and kind of what some of the highlights are.
Right. We worked with George Washington University and the Regional Economic Modeling Incorporated, REMI, in which I know that we wanted an independent analysis of, first, the Medicaid expansion and its impact on Arkansas, and number two, the numbers that Dr. Andy Allison had projected the savings that would occur through Medicaid expansion. So I know we wanted an independent look at those, and we know that the state legislature has engaged REMI to look at the Mississippi County Steel
Super Project.
So we felt like it would be a good independent analysis. What we found was that the amount of money that's going to be coming into the state through Medicaid expansion, if it were to occur, $800 million a year. It would increase to $1.3 billion over the years at its peak. We're talking about, in this study, that equates to 8,500 jobs up to 11,000 jobs. So it's certainly an economic impact, an economic driver if we do accept those dollars.
These are things that happen within the healthcare industry, that $800 million, up to over $1 billion that you're talking about, things that have an impact, a ripple effect through hospitals, medical clinics, nurses, the whole home health care system. That's what we're talking about, right? That's
what we're talking about. When those monies come in from the federal government and they're paid to providers employ doctors, they employ nurses, they have staff. Those people go out, they buy cars, they buy groceries, so it's a rollover effect in the economy.
Now, the study does not take into account maybe some of the negative aspects of that, what the economic impact of the federal law may be in terms of new taxes on businesses, for instance, or new regulations and some of the things that might shift some people into different areas. That's not in this study, is it not?
No, it's not. We had a narrow focus, and that was to look at the impact of these new dollars coming in and what kind of job creation it would be, job retention, and the new dollars coming into the state and the rollover effect in the economy.
So there could be some counterbalance there, I guess is the point I'm trying to make.
Sure.
It could be. All right, let's talk to your timing was impeccable. You guys rolled out some poll numbers, too, about Medicaid expansion, which we may discuss what we call this Medicaid expansion concept because we had a shift there at the Capitol this past week. You guys actually asked Arkansans a similar question to what we did a couple of weeks ago in terms of do they support Medicaid expansion in the state. You guys found what?
We found that they did, up to 65-70%, depending on the information that they had before them. If it was to support rural hospitals and the jobs that they represent, you're looking at 70% support. Medicaid expansion, just that, we're looking at 53 to 65% support. There's a broad support out there for Medicaid expansion and the jobs that it could represent, the impact on hospitals, and just the moral obligation. We found 90% felt that we had a moral obligation to our fellow man to take care of them.
I'm sure you saw our interview earlier in the week with Senator Larry Teague, who talked about the fact that if there is not some form of Medicaid expansion, additional money pumped into the healthcare system, then rural Arkansas has probably brought its last job to that community. You agree?
I agree. It's the rural hospital is the lifeblood of these rural communities. In the counties that there is a hospital, it's the number one, number two employer in that county. So, and we've seen through different sales tax votes to keep the hospitals open, that those will pass at 85 to 90%. So there is strong support for the hospitals in the community, and it's a part of the economic impact, the economic engine that drives those communities.
Let's talk about the Medicaid breakthrough that occurred this past week. On Tuesday, Governor Beebe shared with legislators the fact that the federal government has given the state permission to take Medicaid dollars for expansion and use it into the health insurance exchanges to basically move this population of Medicaid expansion into a private insurance kind of silo there. You like that move?
We do like that move. We thought it was a very positive move that Governor Beebe went and visited with Secretary Sebelius. He took Republican legislator ideas to Washington, got some flexibility, came back, presented those ideas, and we think it's a positive step, and we hope to see that this could lead to passage of Medicaid expansion in some form.
Straight up Medicaid expansion under the old way or this new model, this hybrid that we've been approved to, which is better for Arkansas hospitals?
Well, the devil's in the details, but I would certainly say at this point right now, if hospitals could be paid commercial insurance rates, that's better than Medicaid rates that we could be paid. So devil's in the details, but we're certainly positive. It was going to be hard to get a 75% vote of the House and the Senate just having straight Medicaid expansion, so I think this is going to help push this further.
And you hadn't been counting noses, so you wouldn't know if it was, I mean, maybe, okay, because that is your job. Do we still call it Medicaid expansion under this new concept that has come up here? I've heard some legislators refer to it as Medicaid contraction. I've heard others refer to it as the private option. Not that it necessarily matters what we call it, but I mean, what's kind of an accurate description to you?
I think certainly the private option, because we're taking federal dollars and we're going to go into the private market. We're going to purchase an insurance product to cover these individuals, so it's going to be a private transaction.
You said the devil's in the details. Give me a couple of details that you think need to be correct for this to be good for Arkansas hospitals.
Well, certainly in theory, getting commercial insurance rates is a good thing. A concern to us, if you go on the exchange and you buy one of those insurance products, what is going to be the copays and deductibles of that Medicaid eligible patient? We're talking about people with a yearly income of $15,000 or below. Is there an expectation that they should pay 30% in copay and deductibles? That's unrealistic. That's uncollectible by the provider. So I think the details of the copays and deductibles are certainly.
You guys will be at the table doing some negotiating on this?
We will certainly be there.
You hope to be there. All right. He's BoRyall, president of the Arkansas Hospital Association. Thanks for being with us.
Thank you, Roby.